How did we mismanage the obesity epidemic? In the article that I wrote, I talk about the three major industries involved: the medical industry, the wellness and fitness industry, and the food industry. The medical industry, for example, mismanaged this because for the most part, they didn't even begin to teach exercise and nutrition until the late 90s, and most maybe by the early 2000s. The wellness and fitness industry, who are most involved with those, would have been involved with the people who are overweight through exercise and nutritional modalities, really dropped the ball because we were more focused on exercise science, biomechanics, and the like, and we treated people who were overweight as a behavioral problem. Nutrition and the food industry, on the other hand, were really trying to solve a problem that was related to the research of the time, which is that we needed to reduce the amount of saturated fats in our diet. Inadvertently, they created a process of refining carbohydrates, which likely gaslighted the problem and made it a lot worse. So what do we do going forward? Well, I think the first thing is that if we would have been researching obesity as a disease, we might have noticed that there was a cultural shift that happened that really created the problem. And this cultural shift was really based on technology. Many of the things that we used to do that were physical in nature, we replaced them with sedentary activities. And many of the things that we as a culture did, like cooking, we replaced them with eating out. We watched a lot more television. We didn't move as much. And so if we would have been researching and studying this, much like we did with the HIV/AIDS crisis, which happened in basically the same time frame, we might have observed that there is such a thing as being overweight and fit, and conversely, being skinny and unfit. We may have observed the obesity paradox a lot sooner. Going forward, we know, of course, that a calorie isn't a calorie, that some calories actually create a scenario in our bodies and our brains where we actually want to eat more food. We know that it's important to educate from young to old about the benefits, the health benefits of being more physically active. We know that. And so going forward, I think we're in a little better position because we're beginning to understand not only obesity, but the effects of obesity and how that plays out in our health outcome, health status. We also know that managed care does not equal health outcomes. And we know that regardless of the rising cost of medicine, it doesn't improve health status, and it doesn't increase the quality of the care that we're receiving. What do you think? Let me hear from you. Leave me a comment. Let's talk about it a little more.